here with Brian Sowards, CEO of Infopia USA. So Brian, can you talk a little bit about the role of technology in increasing diabetes compliance?
Sure. I think technology in the diabetic space makes a lot of sense for a number of reasons. One, it kind of increases efficiency within the suppliers. There's a lot of reimbursement cutbacks, other things coming down the pipeline, and that technology obviously would help leverage the suppliers and be able to, look at, what patients need what products in a timely manner, be able to track utilization. There's also other auditing and regulatory issues that suppliers sometimes face, and having some type of central repository which tracks all of the test strips and tracks the outcomes and the usage, and certainly put them in a better position for in case of an audit.
Is telemedicine a technology that's kind of a good fit for the diabetes market?
Absolutely, and it's really so remote home patient monitoring is a sector that I think is more fit for diabetes and the diagnostic device at home. It's a big push in the industry to have diagnostic devices that could then communicate through some type of form, whether it be a regular telephone line or an Ethernet line or even cellular connectivity. But by getting those types of devices and being able to upload results into a central repository, some type of a protected server, and then it could go through some type of a filtering program like a digital care plan. Mm-hmm. And based on parameters and based on certain thresholds that you put in place, then the server could automatically alert nurses or disease management companies or family members, in case there's some abnormalities or anomalies in their reports.
Well, what else do you see coming down the pipe? Obviously, telemedicine sounds like it'll play a bigger role in the market, but 5-10 years, I guess, how is this market going to look?
I think in directly related to diabetes, I think the meters themselves have kind of hit the end of the road where, at our company we've got a new meter which is a 3-second 0.3 microliters, no coding type technology. I think as far as its sample size and test time, there's very small sample size, there's very quick test times, and I don't really see the industry pushing that direction in the future. I think it's going to be more focused on accuracy, it's going to be focused on connectivity, it's going to be focused on when you provide the patient the opportunity to perform the test, how are you able to help that patient manage their diabetes? And that's where remote home patient monitoring is, where you can take that test result and share it back to the healthcare community, and then with insurance companies, and prove some type of utilization and compliance, and just trying to make that patient a healthier patient with diabetes.
What about mail order? I mean, do most providers do mail order? I mean, is mail order going to be the way, dominate in the future, you think?
I think mail order certainly is attractive in the diabetic industry because it's something, since it's a residual, stream of products, it's a chronic disease, so people are using the test strips on a monthly basis, so efficiency-wise, that makes sense. I think that the industry also has to remember that there's some types of accreditations or some types of services that need to be standard within the diabetic community. For competitive bidding, they're looking at a number of different variations within the diabetic side of it. One is having a 1-year contract, and then after that maybe going to a single provider formulary. Although I think the industry is going to move in that direction, but I don't, to me that doesn't seem exactly fair for other diabetic providers. It seems like, in my opinion, that we would form some type of diabetic accreditations, is that put everybody in a level playing field and say these are the things that we expect out of somebody that's going to provide diabetic products, and put people into a level playing field, and then allow some type of a bidding process. Because I think some of the anomalies that showcased in the first competitive bidding were suppliers that weren't necessarily in the business, didn't really calculate all the expenses that it would take to handle that size of a business, and so they kind of put out pricing that wasn't really realistic.
Well, what's the mood out there in the diabetes market about, a restart of the competitive bidding program?
I don't think anybody likes competitive bidding in any part of the industry. I know that at first the Congress said that they wanted to just take a reduction in pay. I think everybody would rather just take a reimbursement cut rather than doing some type of competitive bidding. And so it's, it'll be curious to see exactly what happens. I know there's a lot of organizations within the industry that are fighting for it. I know that we're certainly trying to do our share as well. And so I guess we'll find out.
Great. Thanks, Brian.
Thank you.